Concerns about the COVID-19 vaccine remain top of mind for Canadians as we grapple with the second wave and new variants of the virus. In this week's Q&A with Toronto's Associate Medical Officer of Health, one of our viewers wanted to know more about the side effects of the vaccine and how they're being tracked by the government for further study.
You can actually expect to get side effects more often after the second dose of the vaccine, actually. We know that it's 40% more common to get side effects after the second dose, and sometimes that's related to, we think, an additional boosting of the vaccine. We see that with some other vaccines, like one of the shingles vaccines as well. Speaking with some of my colleagues who work in the emergency department, some have had a fever or real muscle aches or a headache, but they did get better within 1 to 3 days. If you have a side effect from the vaccine, then you can actually report it to your doctor, who can report it to the local public health unit. You can actually report it directly to the local public health department as well. And it's actually a requirement for physicians to report side effects that they determine related to the vaccine. And what we do in local public health is we actually do investigations, and then we report it to the province reports it federally, and you'll see that on the Public Health Agency of Canada, there's a website, a dashboard, that's updated every week with these updated numbers. We want to be sure that the vaccine continues to be safe. And so we know sometimes in the clinical trials where they have thousands of people, they don't have millions of people. And so we know sometimes when you give a vaccine to millions of people, rare side effects may come up. And we want to continue to make sure that the vaccine is safe. And so that's why we're monitoring this, and so we want you to let us know, especially if you have a severe side effect.
This week, the doctor also talked about the difference between the COVID-19 mRNA vaccine and other traditional vaccines. We've got more of our answers up on our websites, citynews.ca and 680news.com. To go directly to the page, point your phone camera to the code on the screen and follow the link that pops up. For City News, I'm Dilshad Burman.